Okay, so we gotta learn about tumor lysis syndrome. Tumor lysis syndrome, okay. So what do we gotta know? We gotta know that it's associated with cancers and even in children. Here we're thinking about leukemias, and let's not forget that that happens in kids as well. So it's spontaneous, and some features we gotta know about. Uremia, got hyperphosphatemia, hyperkalemia. You can also get an elevated LDH, and you can develop AKI. All right, so here we have Oprah telling us she's gonna give us phosphates. So don't forget that. Okay, one thing I forgot to remind myself is about the management, and you really want to give IV fluids to prevent renal insufficiency. Okay, next you gotta learn about Hodgkin lymphoma, which I often get questions about this wrong. So let's do it. Let's think about some features. So what do we got? Lymphadenopathy, which is painless. You could have a mass. You can also have, you can also have B symptoms, which is going to be your fever, sweats, and weight loss. You can also have apparently pruritus. Okay. Now, something that I've been getting wrong is its look-alike. That's going to be mono. And how to distinguish that. Okay, mono, you're going to get a sore throat and pharyngitis with this. That often self-resolves. So even though you might have similar symptoms, fever, and it might sound kind of similar, you're often going to get in the prompt something about a sore throat or pharyngitis, or it going away. So don't get that confused like I did. So something to note about Hodgkin lymphoma are that the lab findings you might find in here, interestingly, are elevated LDH and eosinophilia. And why this is important to note is that some of the symptoms of Hodgkin lymphoma can be kind of broad and maybe overlap with something else. So these two things will probably be important to note if they give it to you, that, hey, maybe this isn't something else. An example of that is, I think I came across a question once that was telling me about a patient who had a cough, shortness of breath, and chest pain, which would you might think about something cardiac, pulmonary related, but then it gave me something about the lab findings having an elevated LDH or eosinophilia, and then that should clue you in that this may be talking about Hodgkin lymphoma as opposed to a pulmonary or cardiac thing, which some of the other symptoms might suggest. All right, and here I just added a picture to help remind me about some of the features of Hodgkin lymphoma. Here's this guy representing hog, and the bee representing bee symptoms. And also we have here the fever beaver, and it looks like he's sweating. So, oh, and then also the scale is going down, indicating weight loss, representing the bee symptoms. Okay, let's briefly talk about thrombotic thrombocytopenic purpura, or TTP for short. And then some of the symptoms that are associated with TTP are renal failure, neurologic manifestations, and then fever, hemolytic anemia, and thrombocytopenia. Now, I think the more distinguishing features of TTP will probably be the neurologic manifestations and maybe to some extent the renal failure. So those are the ones to look out for to distinguish it from the other thrombocytopenias out there. And I just attached a little picture here to help me remember those important ones, the brain manifestations, and then also the kidney related manifestations. I guess you can kind of ignore this guy right here. Although kind of in line, you can also think about this as being relating to the hemolytic anemia. But I do love these cartoons. So there you go. So next topic is adrenal insufficiency. And some important clinical features are going to be hypotension, weight loss, fatigue, and hyperpigmentation of the skin. Now, oftentimes the USMLE probably won't give you hyperpigmentation of the skin, but if they do, then this is a clear indication that you should be thinking about adrenal insufficiency. Now, most of the time they might not give you that. They might talk about weight loss or hypotension, and they may give you some of the lab findings. So some of the lab findings for adrenal insufficiency are hyperkalemia, hyponatremia, and I guess those are the two big things. And one thing to keep in mind is to not confuse this with thyroiditis. For example, I think I was given a case about postpartum thyroiditis, in which case you get a hyperthyroid state and then a hypothyroid state. So in those cases, you could get a situation where you have hyponatremia and fatigue-like symptoms, which is kind of similar to adrenal insufficiency. The only thing that I noticed was a big red flag to help distinguish those is the weight changes. So in something like hypothyroidism or postpartum thyroiditis, you'll get weight gain as opposed to weight loss, as seen in adrenal insufficiency. So that's something to keep in mind and to not confuse those two. And so I just put a picture of JFK because he was reportedly known to have adrenal insufficiency, and as suggested by some of his tan-like skin. And so that just helps me remind me about that. And then also he's relatively thin himself, so that should remind me to associate this specifically with weight loss as opposed to weight gain. All right, before we wrap up on this topic, Just wanted to mention that a way to diagnose adrenal insufficiency is to do a cosentropin stimulation testing. So that will come up for sure on your USMLE test.